Good evening and welcome you all to yet another one more session of Ace of the Career. As we have been talking about career prospects, and one thing that we need to always remember, career is something which is definitely not by chance, but by choice. And when it comes to choice, always we should be very smart enough in making our own correct choices, which are much suitable for us, and we can modify it exactly whenever we have some adversities, we have some challenges that we are facing, and that's how we move ahead. And today's session, as we all know, that we are going to provide information about pure science groups, defining them as a very systematic quest means search to understand the nature through observation, theory, and experimentation. You may be asking, like, science is definitely related to all the three: observation, theory, and experimentation, but inside the classroom or inside a demonstration or inside a laboratory, but definitely not so. Even in life sciences, your observation, your theory means your knowledge, and your experimentation adds value to your career prospects. That's what we are going to see today. And to help the students and navigate in these fields exactly, this comprehensive textbook of guiding for pure science group evaluates basically on one's personal interest, aptitude, personality, and then comes the knowledge, experience, and the dream that they carry forward. And why do we just go with all this mapping? Just to determine the best vocation that will suit you. That's what we are going to find out today. So when it comes to the categorization of the scientific roles into the distinct archetypes, which are just as a theory part of it or otherwise a technical part of it. In other words, it's a theory session or a practical session. It's based on each and every one's individual's drive, either academic or the practical work, and where your inclination is there. That's what we have to see. And also, finally, this should help in a larger way with the specialized disciplines by grouping them into the four major biomes of the pure science group. We may be thinking that when it is pure science, we know only botany and zoology. Definitely not so. This pure science group has a category of definitely zoology, that is dealing with animals, botany dealing with plants, and earth elements as well, physiology, and the human system, that is the physical human system. Also, there is a study of human system as well. So this structured approach of the pure science as one umbrella serves as a navigational tool for aspiring scientists, the future scientists and the students who are going to it, to align their natural interest and their capacities with the future professional paths. That's what we are trying to do here. So on that note, I extend a very sincere thanks to IIU for creating this platform for us for exchange of knowledge, and definitely I think many will benefit by it. Now, coming to IIU, it doesn't need an introduction anymore. That's what I'm feeling. Having established in about 195 countries, if it would have been 196, I think Dr. Piyush Pandit would have established there as well. So having established in all the 195 countries, 6 continents, this is a leading virtual education system with the core mission of delivering innovative programs and quality training to young learners globally, much aligned to the SDG 4 of the criteria. SDG 4 is the SDG goals 4, that is inclusive, lifelong, inclusive quality education with lifelong opportunities for all. So they work on that motto. IIU is founded by Mr. Piyush Pandit, a visionary founder, a passionate educationist for last 2 decades, and a very committed social activist. And that's why IIU rules the virtual education system with the tagline as world's first international internship university, inspiring, inventing, igniting young minds. So on that note, let's not waste much time, and let's go into today's topic. So allow me to share my screen here. On today's topic, what we are going to do, we are going to explore the compass of navigating your scientific future. You all are going to become a scientist. How do we do that? what is the baseline assessment that has to be done? The 4-quarter diagnostic with the orientation and the learning style, which evaluates if you thrive in theoretical aspect or academic aspect or hands-on or practical, or where is your inclination, or collaborative or people-forced environments. As a person, where is your learning style, where is your orientation? That has to be done first. And then moving ahead to the nature. Okay, you have found your interest. Then what is required? If at all you have got inherent skills and capacities, let's start working on it. And if at all you require more skills, let us start working on equipping yourself for those skills which are required. So aptitude and natural talent, we are going to map it. And then finally, what best suit your interest, personality, and also the geographical conditions. So this aligns with the intrinsic passions and the character traits of the professional role or the compatibility which is required for the profession that you're choosing. Remember, career is not by chance. Oh, I got it, I'm going to study. Never. It's done always by the choice. Your choice. You are going to start your own career. That's what is called as ace of your career. Now coming to the 4 different studies which are there in the science streams, as we all know, with the biological kingdoms. That is with the scientific biomes that focus on the fauna and the flora, including the specialized roles of the bacteriologist or dendrochronologist, etc., etc., etc. that follows. Not compromising on the earth elements and the scales with the physiology sciences, which are ranging from molecular biochemistry or planetary scale of geomorphology, etc., etc. Last but not the least, definitely the human systems and the healing. The human systems in the healing method, which we normally call it as a pure science study, with the allopathic, Ayurvedic, and the paramedical, etc. So today, what we are going to see, the pure science, the actual medical sciences. Along with that, what other association fields that we can think about, whether it is paramedical or the rehabilitation sciences. Then moving ahead to the zoological part of it, the veterinary hospitals and the veterinary sciences. And then coming to the botanical part of it, with the agriculture sciences. So on that, you can decide which careers suit your best. Why are we going into such an elaborate format is that normally people associate in simple words the pure science with only the medical sciences. But that's not the case. It's so vast, so many career professions that one can think about. If suppose anybody who is not able to make it to the medical career, saying as a doctor, MBBS, MD, what other career prospects that you can choose? In other words, if at all somebody is not able to make it up with the NEET examination, please don't think that that's the end of your life. Explore. Explore with the framework of self-discovery and a curated taxonomy of the specialist scientific disciplines, which are so vast, still you can become a doctor, navigating the universe of the careers in the pure sciences. So green line, the basic field of study, that is with the green line, the science field, which is called as the medicine and the allied health. So stage where we start with the 11th and the 12th, that's the first input with the physics, chemistry, biology, we know that. And then with the transfer of examinations of NEET central selection. Normally this decides with the medical track whether we are going into MBBS, allopathy, BDS, dental, or Ayurveda, BAMS, Ayurveda, or BHMS, homeopathy. And also this is 5.5 years with the major hub degrees with the allied branch, maybe with the 4 years with BSc nursing, the Bachelor of Ophthalmology, Physiotherapy, and B.Pharm, etc. Finally, wherever it is, what's your final destination? It could be either you'll be a surgeon or a trauma therapist or a pharmacist or a genetic researcher, etc., etc., etc. But obviously, one has to accept the fact the NEET examination with 180 questions, 720 total marks is what is required that you need to aim for, where you have a marking system which is glitch there with +4 for the positive and -1 for the negative. However, it is taking it to the right path, how we can go about it. So your future with the pure science, that's what we are going to see here. The foundation of the pure science, understanding the natural phenomena. The study of the nature through observation, that's what we have seen. And scientific methods, research-oriented observators, and then finding your scientific path with the 4-quarter square method. Then going deep dive into physics, chemistry, biology, and mathematics, the 4 academic streams with the diverse specialized careers of animal microbiology, plant sciences, and interdisciplinary activities that we can take, not compromising on the government professionals as well. So the engine of discovery of the pure science is also known as the natural, basic, and the fundamental science is the pursuit of understanding science, and it is driven by a curious mind seeking to describe the basic objects, forces, and the laws of governing them. So the major streams, as we have seen, it is physics, chemistry, biology, and definitely a little bit of mathematics is required. So what are the traits? Basically, observation, that is witnessing the natural phenomena. Are you a person with an interest for observation, witnessing a natural phenomena? With the hypothesis, creating theories and questions. Observation doesn't stop there. It goes to the analysis and the synthesis of the hypothesis. And, okay, you have gained knowledge with the analysis. And then, are you ready to experiment? Yes, testing the scientific methods on the logic, thereby summing it up with a theory, establishing the information, and increasing knowledge of the specific. If you are into this engine of discovery, then your science is definitely your cup of tea. So mapping it with the natural capacities, with the maths and computing, logical reasoning, technical problem solving, which is required, with the scientific critical thinking and experimentation, and the social sciences of the language, communication, and cultural understanding, and also the practical task-oriented abilities for the specific trades and crafts. So a successful scientific career is rarely built on only aptitude alone. That is, aptitude in the sense, I just want to become a doctor, not like that. If you have the capacities of all these things, then your journey is going to be smooth. The intersection of all these natural talents dictates where a candidate will thrive in a lab or a field. So coming to the scientist archetype, you'll basically, the theorist part of you, if you're a very curious, explorative learner driven by the theoretical concepts for knowledge acquisition, the principal investigator with the visionary leaders and strategists who build theories and the real-world application, technician as a problem solvers who excel in hands-on tangible tasks, which requires motivation because every task is not going to be a success. So definitely you need to fall 7 times and get up 8, stand up 8. So it requires motivation to get up with the foundation skill building capacity. So it's basically the graph of the academic drive and the practical drive that really gives you the niche of the scientist archetype. So now coming to the fine tuning of the orientation and interest, how we learn. Academic orientation, as we have learned, it's a theoretical structured learning with the frameworks of deep research, conceptual theories, and educational environments, giving a justification of why, who, when, exactly, and taking it forward with a practical orientation of hands-on real-world application, and also with the closed orientation when something failures, you need to get up and move ahead without having a rigid mindset, broadening your perspectives, and with the people orientation with strong interpersonal and collaborative focus such that you will be always ready to ask for help and move on. That really paves the way forward. Now coming to the scientific, coming to the exact science of the scientific mapping, that is translating the alphabetical ologies, that is zoology, physiology, like that, into distinctive explorable biomes, that is the animal kingdom where we study about the fauna, microlife, and aquatic, the plant world with the flora, trees, and fungi, the earth elements of physical sciences and scales, and the human system of time, data, and health. So this, moving ahead with the animal kingdom of going in detail, deep dive into the animal kingdom, the microcellular. There are 3 domains with the animal kingdom, that is the microcellular, aquatic and marine, and the macrofauna. So all these things will be your option. You can choose any of this. Say, for example, if you're interested in examining human cells and abnormalities, you can become a cytologist, and studying about, if you're interested in studying and evolving bacteria in the labs and pharmaceutical government agencies, etc., you can become a bacteriologist. And going with the aquatic and marine, if you're interested in study of life processes in water, exploring about the marine animals and aquatic animals, then you can become hydrobiologist. And study of fish species with the history, behavior, and the ecosystem, you can always become ichthyologist. And also about when you study about the homeothermic vertebrates, that is with the complex nervous system on the far end, etc., then you can become a mammologist. Study of birds and non-human primates, respectively, you can become an ornithologist, primatologist, and study of the faunal remains, you can become archaeozoologist. So pure science doesn't mean only the doctor, MBBS, MD category that we are thinking about. These are also some of the careers that people can think about choosing, making their own careers in the field of pure sciences, with the study of pure sciences. Going detail into the microfauna cabinet, that is archaeologist and acarologist, that is specialist in spiders, the micro insects, and arachnids, mites, and ticks also is a study. Going again with myrmecologist, the study of ants is also one study. Lepidopterologist, the study of moths and butterflies, with the astacologist and cornisologist is the investigation of crayfish and the taxon of lobsters, etc. Parasitologist and helminthologist, study of parasites and parasitic worms, also becomes a specialized study. These are all very specialized study. When you go to the general physician, finally they will say you go bring the lab report and we will check with the parasitologist. So that's where you come in, like if you're interested with that. And nematology is the study of microscopic roundworms and their interaction with the plants and soil and water. So if that's the study of zoology, now coming to the plant world, that's biome 2. So you, on the whole, you will become a botanist, that is then phytologist, the study of plant kingdom, effect on the environment in creating herbal medicines and protecting species, etc. The specialist, the biologist, the study of non-vascular complex plants, mosses, liverworts, and teratodologist, study of ferns and other pteridophytes, and orchidologist and bathologist, special of orchids and wild bushes, etc. When I was doing this research, I was really familiar with the study which one can take up as a career with pure science as a core of course, exactly. And the health and the disease, phytopathologist, that is studies plant diseases, causes, effects, and also last but not the least, you can always, if you're very curious in learning more about trees at the time, you can always become dendrochronologist, that is the study of the annual rings of the trees to determine the chronological order of past events. Isn't it amazing? And why are we really thinking about only NEET examination if you're going to fail NEET and your life is there? Never. So coming to the biome 3 of the earth, elements and scale, with the micromolecular chemical and the human material, and the macro with the planetary and ecosystem. So the micromolecular study with enzymologist, the branch of biochemistry concerned with enzymes. Analytical chemist with the conducts the laboratory research, develops products and designs and analytical instruments. And the human material scale, you can always become mineralogist, gemologist, study of soil, natural occurring inorganic substances and gemstone materials. Lithologists, experts in study of rocks. Then macroplanetary ecosystems when it comes to geomorphologists, study of how Earth's surface is formed, changed by rivers, mountains, and air and ice. Glaciologists, study of snow, ice, and their physiological properties. Chronologists, studies about the relationship between the geographical phenomena and the spatial changes that are taking place. That's biome 3. Now, when it comes to biome 4, which everybody is very familiar with, the human systems, that is the time in the biology as chronobiologists, the study of body, natural, mental, physical, emotional cycles and affected by the solar lunar rhythms. With the humanity and the history, that anthropologists and paleoanthropologists, that is, studies the development of human beings and the organisms of early humans to better understand the humanity. With the health and investigation, epidemiologist and exotoxicologist, that is ecotoxicologist, analyzes the distribution of diseases in population, the effects of toxic chemicals in the biosphere. So obviously the mathematics and the risk, when it is there, when any data is there, you need a mathematician in account. So evaluating the final impact of the risk, uncertainty, and replacing model structured data to analyze and to prepare a very feasibility study or contingency report and the plan to solve complex problems. Definitely mathematician, the role of a biomathematician is definitely required. So with the aligning the campus map with a case study and your career path, you have to decide what is your personality, whether you're highly academic and low practical, or you are very scientific and mathematical, or your interest lies in micro ecosystems or low people orientation, etc., etc., etc. If you have these capacities, then obviously mycologist or protist-locologist. These fields require deep solitary theoretical research into complex organisms and fungi, relying on the profound academic drive and scientific experimentation rather than public-facing practical execution. So, with that, these are the different carriers that are exposed to the pure science groups normally that we have seen so far. And moving ahead, we will plunge more into the medical carriers in India. That's what is the people really want to be their focus on. As we know, the 4 quarters for square method, the basic evaluation of yours with the orientation, personality, interest, and aptitude. There are 7 undergraduate degrees with the MBBS, BDS, and BAMS, and also beyond the clinical practice with the you have a career option of getting into medical journalism, medical legal advice, and corporate hospital consulting, where you can prepare business plan for the hospitals and the medical centers. Last but not the least, definitely there is always an option of competitive government roles, which includes the UPSC, combined medical services and medical officer positions in defense services, etc., etc., etc. So let's go into the blueprint of the medical career, navigating the degrees, systems, and specializations in India. So, what is your DNA? If you're choosing the medical sciences, the pro-medical sciences as your career, what is required? What is your DNA? This medicine requires more than just academic excellence. It demands highly specific, multi-dimensional profile with very high academic orientation, very high people skills, very high aptitude for life sciences, very high ability to memorize data, very high analytical and observational skills, with a very strong commitment and tenacity, ability to work long hours, and ability to lead and work within teams with great time and stress management skills. If your DNA says that, yes, I am there, I have the DNA of the healer, then we can go ahead in that. With your interest, aptitude, and orientation, personality, definitely we can go into that. With the core objectives of the medical education, that is the physician skills and aptitudes, patient care and ethical professional practice, discovery, clinical and basic research. It's a lifelong learning opportunity, means this is what that every day is exploration. Every day you need to explore. Every day you need to update yourself in the field. Of course, that is required for every single field these days, but this requires very strong inclination towards research, because we are dealing with lives of people and the macro public health, medical education, leadership and management. So the medicine is the science and practice of the diagnostic treatment and the prevention of disease using the therapies as diverse as pharmaceutical, surgery, psychotherapy, and biological interventions, etc., etc., etc. Now, what does the academic architecture says? Basic, we start with 10 plus 2, that is PCB, with physics, chemistry, biology, with a phase 1 bachelor's of 5.5 years, that is 5 to 5.5 years, with MBBS, BDS, BAMS, BSMS, BNYS, BHMS, UMS, and phase 2 with an elongated, with a stretched learning of 2 to 3 years plus, that is MD, that is PG, which we call it in the normal way, MD, MS, MDS, MSc, DNB, MHA, MPhil. With the phase 3 as pre-doctoral for 1.5 to 3 years, that is DM of medicine, that is Master of MPhil, etc., etc. And phase 4 is doctoral after doctoral, that's 3 years, that's PhD, BSc plus. And as per NAP, the latest NAP 2020, the MPhil program is being discontinued across India, and the focus was shifts to the research intensive master's degree. Why? Because if people are failing, what is the reason behind it? If people are not able to make it to NEET, we are closing all the other gates for them. That is the phase 2, phase 3, phase 4. So to keep that as the thing, to keep it open with a broader spectrum, this has been open. So that's the main reason. And the systems of healing, exactly, we are going to go detail into the study, exactly, which one is, what is the study, and then we will go into how it suits you. The comparison matrix of allopathic MBBS, that is a conventional modern healthcare, evidence-based practices using pharmaceutical drugs, surgical intervention, and advanced diagnostic technology. And Ayurveda is BAMS, ancient Indian system balancing mind, body, and spirit, using herbs, physical therapies, and lifestyle modification. Homeopathic BHMS is based on light cues like using highly diluted substances to trigger the body natural healing system. It's a longer process, but it's definitely result-oriented. Naturopathic BNYS, that is focusing on the healing power of nature through non-invasive self-healing therapies, fasting, much therapy, and acupuncture. With the Shuddha BSMS, the South Indian origin, focusing on the root causes like the physical, mental, spiritual, using earths, minerals, metals, and yoga. And last but not the least, the Unani BUMS, the Perso-Arabic medicine, focusing on balancing the four body elements, that is blood, ligum, and yellow bile and black bile. So if these distinct studies that we are going to look into, the conventional pathways with the allopathy and dentistry also adds on there. The MBBS is 5.5 years. It includes 1 year of rotational internship where you can work with the hospitals, qualifies practitioner as a scientist, certified clinical specialist. Core subjects that you can think about in the field of MBBS is anatomy, physiology, pharmacology, microbiology, general surgery, forensic medicine, toxicology, obstetric, and gynecology. When it comes to BDS, that is talking about the dental, 5 years that focus on exclusively on the diagnosis, prevention, and treatment of teeth, gums, and mouth and jaw disorders. And the core subjects include oral histology, conservative dentistry, and endodontics, and periodontology, and oral and maxillofacial surgery, public health dentistry. So, alternative philosophies, that is IIU, which comes under the header bundle of IIU, is that these are alternative fields that we can think about with Ayurveda, BAMS, with a profound knowledge of Ashtanga Ayurveda, supplemented by the modern advances. The core study with Charak Samskita and CAREERS-Epi, Dravya Guna Vigyan, and Rasa Shastra. With the homeopathy BHMS, the study of highly diluted substances and therapies, with the core study of organelle of medicine, materia medica, homeopathic pharmacy, case taking, and laboratory. And the naturopathy and yoga, that is BNYS, is a non-invasive natural healing yogic principles, with the core study of philosophy of nature care, fasting therapy, chromomagnetotherapy, and manipulative therapy. With the Unani and BUMS, enhancing the natural power based on Vichar street, temperament, history of medicine, and regimenal therapy and toxicology. It doesn't end there. With the specializations that you can think about only the brain and the nervous system. Now we have seen human body as a core study. Okay, the neurologist diagnose the disorders of brain, spinal cord, nerves, muscles, etc. And neurobiologists with the anatomy, physiology, biochemistry, and the nervous system and its effect on behavior. With the neuropsychiatrist, investigates the critical link between the mental illness and the organic disease of the brain. The chronobiologist studies the biological rhythms of internal timekeeping mechanism governing physiological process, etc., etc., etc. And apart from that, there is again a specialization of study with only the internal organs and the systems, that is cardiologist for the heart, and a pulmonologist for the lungs, gastroenterologist for the digestive system, and the hepatologist for liver and pancreas, nephrologist for the kidneys. And specializations of head, neck, and surface, that is ophthalmologist, obviously for the eyes, and with the ENT, and for the ear, nose, and throat, and a rhinologist for the ENT, focusing on the nasal cavity only, and sinus and the olfactory system. Dermatologist diagnoses the treatment of skin, hair, nail, mucous membrane disorders, acne to skin cancers, etc. And trichologist, the specialist dermatologist, focusing on the study of health of hair, scalp, breakage, thinning, etc., etc., etc. So these are the different specializations of the medical sciences which are involved in it. It doesn't stop there with the specializations of systematic foundational, with the endocrinologist for the glands and the organs that produce hormones, regulating metabolism, growth, and mood. With the immunologist focusing on the immune system, response to the infections, managing autoimmune disorders and immunodeficiencies. Oncologist manages cancer treatment modalities, including chemotherapy, radiation therapy, etc., immunotherapy. Hematologists treat blood diseases like iron deficiency, anemia, leukemia, etc. Rheumatologist diagnoses autoimmune musculoskeletal disorders affecting joints, bones, connective tissues, arthritis, etc. So these are also specialization study that you can think about. Apart from this, totally, which there are allied carriers which you can think with the medical sciences, pro-medical sciences which you are thinking about, the science behind the clinic. not exactly the clinic, means exactly where the medical system is going on. Apart from that, there are other behind the clinic, out of the scenes, pharmacologists, the study of drug action, how man-made drugs, natural drugs, and the molecules exert biochemical effects on cells and organisms, etc. There's a study for it. Toxicologists overlaps biology, chemistry, and pharmacology to study of adverse effects of chemical substances in living organisms. Biochemists, who studies DNA, protein, cell parts, and effects of food additives and medicines. Apart from these fields of study, there are also two distinct studies. That is studying about the medical equipment and manufacturing. That is the sunrise sector driving tech innovation, regulatory frameworks, etc. for the medical equipment, calibration, servicing, and the implementation and the orientation. Everything is that including the medical equipment and the manufacturing and the services which are included in that. Apart from that, there is a field of study which is always called as a clinical researcher, operates in pharmaceutical industries, the biotech companies and research organizations, that is CROs, that they always publish research papers regarding these medicines and so on. So these are the different allied carriers which also can be thought about. So leaving aside, now coming to the community, from the pure science, the study of pure science relating to the community, what could be the allied carriers with the administration, law and communication that you can think about is medico-legal advising, that the interface between the doctors and the legal processes which are involved in it, handling claims, complaints, regulatory issues, inquests, criminal investigations, etc. That is also one field which is there. Obviously, hospital administration consulting takes care of the business related of the activities of the corporate hospitals, solving complex efficiency problems so doctors can focus on treating patients. And last but not the least, the medical journalism writing, creating clinical trial reports, regulatory submissions, journals, publishing patents, patient education materials, etc., which is ideal for medics with a passion for writing and public communication. So these are also the different carriers that we can think about. And always coming to the relating to the community aspect of it, with the government of India, there are combined medical services with highly competitive UPSC examination to place more than 1,000 officers in central and state boards, including railways and central services. So that is always there. With the defense services, the medical postings with the armed forces, infantry units, army hospitals, emergency services via Army, Navy, and Air Force. So the medical sciences offers a blueprint far beyond the clinic. So by applying the 4 quarters square method, assessing your own orientation, aptitude, personality, and interest, you can navigate the snap to find the exact specialization where your unique DNA meets the world's healing needs. So that's with the medical sciences. So that's what we have seen today with the medical sciences, navigating the medical carriers in India. Moving ahead, the other field that we have seen, the paramedical sciences. That's another field that we can think about with the foundation of paramedical. That is the technical roles. They are not exactly the MBBS doctors, but these people's roles are very, very crucial in assisting the doctors, like anesthesia person, anesthetist, radiologist, and also the drug inspection people. So obviously your diverse specializations will be any of the above mentioned one, with the attributes of highly academic orientation, strong observational skills, very deep empathy for the patients. So with the essential healthcare support, this paramedical science is called as a healthcare support, manage the pre-hospital emergencies and supplement doctors with non-surgical cases. And definitely this is a very rapidly growing sector, and to handle all the pandemics, when that where we are living, the world that we are living is, it has a lot of challenges. So definitely these are most very competitive roles that you can think about, with BSc nursing, B.Pharm, and B physiotherapy. Apart from that, beyond the clinical aspect, there are always medical journalism, pharmaceutical manufacturing, and technical writing for engineers. So the healthcare blueprint of the paramedical sciences that we are going to see now, which are definitely, in other words, called as a backbone of the modern medicine. So defining the pathways beyond MBBS, the next generation of healthcare professionals whom we are going to see here. So the medical system requires a new architecture. As we know, the pandemic exposed a critical reality. The healthcare doctors only cannot handle the situation. The healthcare is rapidly growing and expanding medicine. Doctors are not the only component. The increased environmental hazards and complex diseases have created unprecedented demand for specialized healthcare professionals who are paramedical staff. So the solution is the paramedical staff, job-oriented specialties dealing with pre-hospital emergencies and non-surgical cases. Without paramedical staff, medical treatment cannot be served. They are the frontline responders and the diagnostic eyes and the technological operators of modern hospitals. Diagnostic, surgical support and emergency, handling the emergency situation. So normally in a hospital situation, what is the patient pathway? Where the paramedics operate is in the emergency department. As such, with pre-hospital care, diagnostic, uncovering the unseen, helping the doctors to uncover the unseen with the pre-surgical preparation, operation, they are there helping in the operation theaters, and recovery and rehabilitation. As we know, nurses are more closer to the ground. So the advanced paramedicals establish the trauma emergency medical technicians manage the airway. CT scan technologies and psychotechnologies provide the clinical data, very important data, analyzing and scrutinizing the whole situation of the medical history. Anesthesia technologies prepare the life support equipment. Perfusionists run the heart-lung machines. Operation theatre assistants maintain the sterilized fields. Physiotherapists and dialysis technologies manage the chronic recovery with the nurses. So where do the paramedicals operate? These are the fields where the paramedics operate. So, what is the anatomy of the paramedical professional? Who is full of empathy and compassion, humane, polite, attentive, driven by the desire to help people live and smoothly, happy and independent lives. With the cognitive, highly academic orientation, high aptitude for life sciences, exceptional analytical skill and the ability to memorize complicated data, with the technical dexterity and precision, fine motor skills to regulate, operate intricate machinery, prepare surgical environments and handle delicate biological samples. With the physical stamina, capacity to endure long hours in the clinical environment, transport patients and maintain focus during high-stakes emergency management. Why are we going in detail? Because after choosing paramedical, you shouldn't repent or you shouldn't, worry later, why did I even choose this field? If you feel that you have this aptitude, then you can go for it. Obviously, with the interest of aptitude, personality and orientation, you choose your career sweet spot and decoding with the clinical archetype of whether you are a scholar, the academic orientation, the visionary, the creator, the builder, which domain that you fall into, that you really work on it, and then you can go ahead. What is the educational staircase says that the base requirement of 10+2 PCT, that is physics, chemistry, biology, with the foundation of bachelor's 4 to 4.5 years, that is BSc, that is pharmacy and ophthalmology or physiotherapy or B.Pharm, etc. With the advanced specialization of the 2 years with MSc option of M.Pharm and ophthalmology and MOT and PT, with the ultimate mastery of doctors with extension of 3 to 6 years from the degree and DPhil and DSc. So where you belong to, you need to think about where you want to stop, that you have to decide. It depends upon exactly where you fit in and how happy you are with your process. And the clinical ecosystem, what does it say? Where you will be working exactly in the medical laboratory technologists. What are the different roles or the job roles that you can think about in this? Medical laboratory technologists, cytotechnologists, biochemists, CT scan technologists, cell geneticists, where you'll be working in diagnostic labs. And with the surgical and emergency, you can think about advanced care paramedic, anesthesia technician, perfusionist, and operation theatre assistant. With the therapeutic and recovery, you can think about physiotherapists, dialysis therapy technologists, burn care technologists, movement therapists, etc. And the specialized diagnostics with cardiovascular technologists, eco-technologists, EMG technologists, and neurodiagnostic technologists. So these are the options which are open for your candidates. So when it comes to the specialization matrix of the core BSc pathways, moving ahead, anesthesia technologists' core focus will be preparing for OT, operation theatre and assisting surgeons. Key skills that you should require is autoclaving and patient positioning, primary environment with the tertiary care and operation theatres with the key core subjects of pharmacology, and applied pathology. So the next study could be cardiovascular technology, that is diagnosing heart anomalies, where echocardiography will be the skill with the electronics, where you will be dealing with the electronic equipment, etc., with the primary environment of cardiology diagnostic labs, and the key core subjects will be cardiac myobiology and biophysics. And the critical care technology, where it is emergency intensive trauma will be the core focus. And the key skills required is to study about CPR and airway management. And primary environment will be intensive care units and also ambulances, where the key core subjects of study will be traumatology, obstetrics, and the emergency handling management. The other BSc pathway is that dialysis technology, where the core focus will be managing chronic renal failure, where the key skill includes machine sterilization, group dynamics, where the primary environment is the renal transplant units and clinics with the key core subjects as biochemistry, renal disease concepts. So, beyond the hospital walls, definitely your paramedical degree is a versatile foundation for a multi-industry career, that with the government and defense, we can join the armed force or the civil service with IAS, IPS medical service as a commissioned officer or specialized public servant. With the manufacturing and innovation as your interest, the medical equipment and the pharma manufacturing drive the healthcare tech boom by overseeing the industrial scale synthesis and equipment configuration. And if you feel that you are good at outreach and communication, medical journalism with the NGOs, translate complex scientific research paper for public work and rehabilitation of vulnerable populations. And information and regulation being yours, you can become a drug inspector with the quality assurance and quality control systems, monitoring, safety, enforcing environmental laws, and managing complex health information systems with the clinical coding. So these are also the careers which are open to you. Now, becoming the blueprint of tomorrow's healthcare, the future of medicine relies on the specialized, highly trained professional who turn scientific theory into life-saving education. Your unique aptitude and personality are the missing pieces in the global health ecosystem. If you fit there, if your interest lies there, please go ahead. So that's what the future of medical sciences says. Now, there is another field of study which is more associated to the medical sciences, the rehabilitation sciences, which you can think about. Definitely restoring functional independence with the disabilities and the optimal participation in the daily activities. As we are talking about rehabilitation, we are going to give hand to them to cope up and recoup and regenerate and rehabilitate, come back to normalcy. So in that case, it definitely helps with the diverse specialized roles of special educators, rehabilitation engineers, clinical psychologists, and audiologists, etc. Essential candidate qualities. Success requires strong communication, compassion, patience, and critical thinking skills. So moving ahead with the career guide, rehabilitation sciences, the complete blueprint for restoring independence of empowering lives after 12th grade. That is the challenge, the loss of function causes illness, injury, and congenital causes affecting physical and mental ability. The intervention is a rehabilitation science, the targeted set of medical, psychological, and technological measures, outcome, optimal participation, restoring functional abilities, daily independence, and community integration. So, as a set of measures that assist the individuals who have experienced loss of function, activity, and participation to regain their optimal level. That's what this the whole rehabilitation science is all about. What is the anatomy of the professional? Required critical thinking, analyzing the complex patient challenges, problem solving, adaptive solution, active listening, deeply understanding the unspoken and difficult to articulate need of the parents, communication, clearly explaining therapies and conveying empathy to families, being a support, basic than all of these things, compassion, a genuine intrinsic drive to improve the daily lived experience of others, patience in action, guiding clients through slow, iterative process without frustration. If your interest lies there, if your skills lies there, if your personality lies there, if your orientation associated with that, you can think about this as a solution. So the rehabilitation system, definitely with the sensory and communication, you can become, if you feel that sensory and communication is a field of study, that is audiologist, speech therapist, pathologist, orientation and mobility, O&M specialist, hearing and ear mold technicians. If physiology and technology is your field of study, if your interest of study, prosthetics, orthopedics and specialists, rehabilitation engineers and technicians, multi-specialist therapists. And definitely with the cognitive and systemic systems, clinical psychologists, rehabilitation psychologists, special teachers, vocational counselors, rehabilitation social workers, and community-based rehab professionals. Deep dive into the first part of it, the sensory and communication. Audiologists, hearing the doctors, diagnose balance auditory disorders, design treatments including hearing aids, vestibular rehabilitation, and hearing aid mold technician who fabricate the customer diseases. Speech language pathologists as a communication coaches, you treat articulation, fluency, stuttering, cognitive communication, life-critical swallowing disorders, often post-neurological, etc. Orientation mobility specialists, that is O&M specialists, the navigators you are, with the teaching individuals who are blind and visually impaired with spatial skills to travel safely, independently through familiar and unfamiliar environments. So, the blueprint of empowerment, the physical mobility that we all know, we have seen, and we always relate it to the inclusion part of it, the adaptive tech. Of course, all activities are related to the inclusion part of it. The prosthetics, the art of replacement, designing and creating, fitting artificial limbs to restore mobility after amputation and congenital loss. Orthotics, the science of support, designing the assistive devices to correct musculoskeletal deformities, alleviate pain and support existing bone and muscle structures. So being rehabilitation engineers, you are the innovators who will be handling the technological backbone that designs and develops the advanced adaptive equipment and specialized technology utilized by the physical therapist and the patient areas. With the blueprint of empowerment, with a deep dive into the cognitive, emotional, social integration programs, you can become clinical psychologists with target challenge with the deep emotional stress, handling deep emotional behavioral distress, anxiety and trauma, with the core intervention of cognitive, behavioral, psychodynamic thought and therapy, and also the ultimate outcome will be positive mental health and emotional resilience. With rehabilitation psychologists, emotional adjustment to the new disabilities and chronic illness, coping strategies and recovery post guidance, with the acceptance, resilience and maximum independence. With the becoming vocational counselors, barriers to employment due to diverse abilities, career counseling, workplace accommodations and job readiness will be a core intervention, meaningful sustained employment and inclusive workspaces that we will be able to create. So, with the multidisciplinary care ecosystem, that is with the scenario of the patient recovering from the severe neurological event, maybe a stroke, you can be orthotics who provide support, the brace for mobility and rehab engineer, customize a wheelchair. With the speech pathologist works with the restoring swallowing reflexes and verbal articulation. With the systemic rehabilitation psychologist help the patient process trauma, while the vocational counselor liaising with their employer during the workplace accommodations. So, we are never working in silo. We are a part of interlocking wave of empowerment. So that's what the whole science of rehabilitation is into. So, apart from that, where we will be working, you can be working with the defense and the civil services, corporate offices, with the manufacturing, research and development, industries building the implant artificial limbs and adaptive technologies with academia and research. Definitely you can be working with the PhD level research of emerging therapies. Also with the special schools and the NGOs, direct localized interventions of autism, cerebral palsy and intellectual disabilities, etc., that may be working with the rehabilitation center. If that's so, what is the requirement? How long is the eligibility in the course of study? Going into that, the eligibility and the duration matrix. With the visual impairment, it's a diploma for 1 to 2 years, that is, and the bachelor's 2 to 3 years with the BA and masters for 2 to 2 years. Hearing impairment, if that's your field of study of sign language, then the diploma is for 1 to 2 years, bachelor's for 2 to 3 years, and master's for 2 years. And intellectual disability, of course, again the diploma will start with a diploma of 1 to 2 years, bachelor's of 2 to 3 years, and a master's of 3 years. So the eligibility system for all this thing universally stems from 10 plus 2 in each stream, and the BSc requires PCD. So that's what is empowering lives. If that's your career path of the rehabilitation sciences, this is these were different fields of study that we can think about. So now we have talked about the medical sciences with the human anatomy. And now we are going into the biological sciences with the botany as a study, focusing on agricultural sciences. So there is a tech field definitely with engineering, with the management. Agricultural science is also a multidisciplinary aspect, essential for India's economy for plant cultivation to livestock. This also comes under the basic STEM is from the pure science group. This guide helps a student to navigate diverse paths with a structured self-discovery method. There is a technological aspect of it with engineering, technical roles of designing machinery, specialized technical carriers, agricultural engineers, sericulturists, etc., etc., etc. With the managerial aspects of agricultural business, you'll be handling agricultural business management, crop insurance managers, etc., etc. Of course, we can work with the government, with the forestry extension of public sector roles with extension services or forestry ministries and officials with agricultural extension officers, etc. With the academic research, development and treatment with the research scientists and university professors, etc. Of course, there is always a separate non-core scientific that is not dealing with the non-core aspect of the field, but definitely related to agricultural forces. That is the journalism and economists with the agricultural journalists and agricultural economists. Where it all stems from, don't forget the interest aptitude. companion animal veterinarian, that is health and wellness for pets, dogs, cats living in the close association with humans. Veterinary surgeon safeguards the welfare via medical and surgical treatment, utilizing the anatomy, anesthesia, and disease prevention. Veterinary dermatologists, if you have pets, you will be knowing about it, definitely advanced diagnostic for allergies, infections, autoimmune diseases, skin cancers, etc. Equine veterinarian specialized medical care for horses, ponies, mules, and zebras, recreation, sports, activity, etc. The carrier ecosystem of science and research is research veterinarian is one of the fields that you can think about, where you will be developing biomedical advancements, therapies, and vaccines in universities, pharma, and government labs. Veterinary pathologists with the diagnosis of diseases through examination of animal tissue and body fluids, with animatological clinical branches, with the animal scientists, the study of genetics, nutrition, and behavior to improve the productivity, welfare, and sustainability of animal industries. With the veterinary pharmacologist, the expert in pharmaceutical drugs, monitor animal progress during hospital care. So the ecosystem of the industry and agriculture, coming to the field exactly, the food animal veterinarian treats illness and tests and vaccinates the farm animals, the pigs and the cattle, sheep at farms and ranches. So if your interest of study is that, you can become a food animal veterinarian. Food safety inspection veterinarian ensures safety, quality, and the compliance of meat, dairy, and eggs before they enter the food supply chain. Animal breeder selectively mates animals to produce offspring with specific desired traits, size, temperament, performances. Animal nutritionist designs diets for zoo, companion, and agricultural animals to maximize health and productivity. The carrier ecosystem of allied exotic government parts include zoo veterinarian, the highly specialized exotic animal medicine employed by zoological park, and the veterinary technician and care specialist, educated professionals by providing crucial nursing support, diagnostic, and patient advocacy. And of course, social worker for animals advocates animal rights, addressing neglect and abuse, promoting humane conditions. And you can work always with the civil and government services, graduates eligible for IPS, IIS, armed forces, and RBN specific state veterinary officer needs. So, from the pathway to impact, finding your mission, you have to find your trait, who you are, what is the tool, what is your degree that you want to, and your impact, what is your specialization that you are going to choose. So, it's not a single job, it's a vast biofield of waiting for your specific orientation with aligned with the 4-quarter square method. So, thus, navigating a career in the veterinary sciences, that's what we have seen so far. Whether you're specialized with the clinical roles or with research and impact or with the public sector and beyond, but with the academic orientation, strong academic orientation, empathy, and comfort for diverse organizations. Thereby, we have come to the end of today's closure, starting from pure sciences, what are the fields of study that you can take, with the medical sciences as a core field of study, what are the careers that you can take, then about paramedical sciences, what you can think about, rehabilitation sciences, what you can think about, agricultural sciences, what you can think about, earth elements and scale, what you can think about, the human systems of healing, allopathic, ayurvedic, paramedical, rehabilitation, etc., etc. So that's what we have seen today. So with that, we have come to the end of today's session, and we have to stop sharing now. So, I think you have got a field of study that you can choose, but always go with your heart and definitely whatever you feel that is your interest and what skills that you have developed and how you can map it exactly with the application, and everything counts, your mental aptitude, your academic orientation, and also what you want to become. Whether this long hours of working really suits you, whether the animal field suits you, the agricultural field suits you, or whichever field of study that you are thinking about, which you feel that it suits your personality, take it from there and move it. So next week, we'll be talking more about engineering sciences. So thank you, IIU, for giving this wonderful opportunity. Many thanks for Dr. Piyush Pandit, who has opened this platform of sharing knowledge, and we also be very fortunate to be a part of IIU, where it always says that inspiring, igniting young minds. Thank you so much and for the great opportunity. Thank you.